My name is Margaret Greenfields, and I'm chairing this session, and I'm Professor of Social Policy, so not a clinician, although I do have a legal background and have worked with clinicians and people working in this particular area over many years. This is one in a series of webinars that we run in medical school out of the Primary Care Research Centre, where I'm the lead on the inclusion health theme, working along with medical colleagues and Christina, who you meet here, and our other colleague Sophie, who can't be here today. The medical school is headed by Professor Sanjeev Ahluwalia, who is very deeply committed to inclusion health work, and it's an area of his own focus as a GP part-time, as well as being Dean of Medical School. And we're really delighted with the range of work we're doing in inclusion health. Involves a whole wide group of people who experience homelessness, refugees, asylum seekers, people involved in sex work, Gypsy Roma traveller, LGBT plus communities, and other populations who are experiencing exclusion. Some of you may be very familiar with inclusion health work, others less so, but we're very happy to be contacted, and we can sort of link you into various resources, tell you about our work otherwise, and we will put some links in the chat to the Primary Care Health Research Centre and this area of work. So I said this is one in a series of webinars that we've been running for about the last 18 months, all of which are very well attended. And I'm really extremely excited to introduce our two speakers today. Firstly, we have Łucja, and I'm afraid I'm not going to even attempt your surname. I do apologise. René Cassin, which is a legal organisation working to support refugees and asylum seekers in challenged asylum detention. And our other speaker is Anna Miller, who is from the Doctors of the World, who obviously do a lot of work supporting refugees, asylum seekers, people in detention, and in very, very challenging situations. I'm going to, without more ado, actually invite Łucja if you'd like to make a start in your presentation. So you've got up to 20 minutes. I'll give you a 5-minute warning if that's okay. And then we'll switch to Anna. Unless there's any burning questions after your presentation, we can maybe take 1 or 2. Then Anna's presentation, and then we'll open up for Q&A. Please also put questions in the chat you might like answered, because we keep an eye on that, and then we can also bring those in for our speakers. Łucja, over to you.
Thanks so much, Margaret. As Margaret said, my name is Łucja Jastrzebska, and I'm the Communications Manager at René Cassin, and I also lead on our work to promote a compassionate asylum system in the UK. And we mostly focus on safe routes to the UK, as well as immigration detention. So René Cassin works to promote and protect universal rights, drawing on Jewish experience and Jewish values. And we work within the Jewish community by building support for human rights values amongst British Jews and in the wider community. So by bringing the Jewish Authority of a perspective on issues that resonate with the Jewish experience. Could you go to the next slide, please, Christina? Great. So first I wanted to start with what is immigration detention. And so immigration detention is the practice of holding asylum seekers and migrants in custody while they await for either permission to enter or, unfortunately, deportation from the UK. And over 20,000 people were indefinitely detained in the UK in 2024, and a third of those were held for longer than 28 days across 9 immigration centres in the UK and 5 residential and non-residential short-term holding facilities, which are very similar to prison-like conditions. Before I also start, I want to just give a trigger warning. I'm going to be introducing a lot of complexities of immigration detentions that have a lot of different unpleasant topics, which could be triggering for some people. So do feel free to take a break or come back to us as often as you need. Could you go to the next slide, please? Cool. So what are the issues with immigration detention? So it's part of the consecutive government's policy of what the sector calls performative cruelty towards asylum seekers. So basically meaning that it's meant to look as if they're doing more than they're actually doing. So detention is far more extensive than alternatives or an efficient and competent assessment system, and more people detained are released on bail. And there is little evidence that detention or any other immigration policies serve as a deterrent to irregular migration. So firstly, can you go to the next slide, please? I think. Actually, can you go back? Sorry. So I'll start with the abuse. So in 2023, 428 complaints were made over staff behavior and in these facilities, and a further 463 complaints were made about the lack of adequate meals provided in detention centres as well. And this number only reflects a fraction of the real damage caused because most asylum seekers are too afraid to report inhumane treatment because they're scared of being deported mostly. So you might remember a BBC undercover documentary from 2017 on Colebrook Immigration Removal Centre, and that exposed a toxic, brutal and failing environment where self-harm and drugs abuse were a real commonplace practice. And because of that, the suicide rates are obviously very high in immigration detention centres. So immigration detention is detrimental to the mental health and physical health of those arbitrarily detained. And some of those survivors are survivors of torture as well. And they're placed in these conditions where it re-triggers them to be in the conditions that they were prior to coming to the UK. So the suicide attempt rate is extraordinarily high in immigration detention centres, and it's particularly true for minority groups such as LGBT groups and women, although obviously women aren't a complete minority. Can we go to the next slides, please? So I'm going to open up with the LGBTQIA plus refugee experiences of detention. So firstly, I've obviously working in the sector, I've gone to a lot of different events and met a lot of survivors, and the most recent one was Joel Wardy, and he is a LGBTQIA plus activist at Rainbow Migration, which is one of our partners, and a refugee who was detained in Harmondsworth and reported verbal and sexual abuse, those in power or of officers turning a blind eye, and of instances where complaints over abuse are often met with retaliation, inadequate mental health support, and many refugees are face re-traumatization, as I mentioned, and they fear being deported and going back to conditions that might be war or the fear of being executed in their home countries. And on this screen, you can see Manono's story. So Manono is from Malawi, which is a very Christian country where LGBTQIA plus individuals are not recognized. So you have to keep it to yourself. So otherwise you can risk being killed. So when she came to study in the UK, coming out was a huge breakthrough for her. And in Malawi, she was scared that her family would force her to marry a man. And if she didn't, they would kill her. So coming to the UK was a massive escape for her. And she's been here from the age of 18 when she was studying, and now lives openly with her girlfriend in the UK. And she's shared a lot of different stories and the difficulties she faced claiming asylum in the UK. Some was bizarre requests from the Home Office officials for evidence of being LGBT. And obviously, that she doesn't have evidence to give, because if you had evidence to give in Malawi, she would have risked death. So a lot of those evidence claims that the Home Office wants don't exist for people like Manono's. So in her case, she is still actually awaiting detention after 5 years of waiting. And she was originally held in an immigration detention centre and detained more than once, which is often the case for a lot of refugees in the UK. And the first time she was detained, she was in shock as she did not know what to expect from the process. So while being locked up and with no privacy and appalling healthcare treatment by the medical staff as well, she described the experience like serving a death sentence, triggering many mental health problems, and mainly from the fear of being sent back to danger. But once released, she was initially homeless until the Home Office arranged accommodation for her. And that accommodation itself had awful conditions, and water, for example, water from the upstairs toilet was leaking into the bed through the ceiling. So again, it's just simply not good enough. And one of the quotes you can see on the screen is, "Being in detention made me feel like I'm not a human being. I felt like I was just a number. It made me lose my confidence. It's so hard not knowing how long you'd be there, because being in detention is the worst place you can be. which is a shock, and everyone detained is struggling. It's a very bad place to be a woman. I am scared of going there again. I never want to go back. Detention is a very, very bad place. And later I'll share how you can support Rainbow Migration's No Pride in Detention campaign by signing up for No Pride in Detention, as you can see on the screen. Cool. Can we move on to the next slide, please? So now I'll move on to women's experiences of detention. So immigration detention poses added threats to women, as you heard René as well. So research from our partners, Women for Refugee Women, show that the majority of women detained are survivors of gender-based violence, such as rape, forced marriage, and genital mutilation. And rather than allowing women to rebuild their lives, the treatment they're subjected to often replicates and continues the patterns of control that they are trying to escape from. Can we go on to the next slide, please? So many women seeking asylum are detained following the Home Office refusal of their asylum claim and becoming appeal rights exhausted, basically. So this doesn't mean that they do not have a valid asylum claim and don't need protection in the UK, but there are many reasons why women are wrongly refused asylum. And again, this happens very frequently. The first one is there's difficulties in disclosing the abuse and violence that they have been subjected to, because women find it very hard to talk about experiences of rape and other gender-based violence because they are traumatized, and as well as feeling of stigma and shame in their countries and even coming over here. So this means that the true nature and extent of their persecution is not always documented in their initial asylum claims. The second is that there's an ongoing lack of understanding among decision makers, so about the often particular nature of women asylum claims, so despite the publication of official guidance on this as well. The third is the difficulties of evidencing, as I mentioned before. So the forms of persecution women often experience, such as rape and domestic violence, with this alleged lack of evidence then used by the Home Office to justify the refusal of their asylum claims. And lastly, poor quality of legal advice and representation, because solicitors do not always have the necessary experience in or expertise in women asylum claims, and they don't often ask the right questions or put forward the necessary evidence to establish their claim for protection. So where are women detained? Can we go on to the next slide, please? So until August 2020, Yarlswood was the main detention centre for women, and due to the falling numbers of women detained, however, it repurposed as a men's detention centre. So in December 2021, Derwentsside in the northeast of England was opened as a women's detention centre, and Derwentsside has capacity to hold up to 80 women, but the number of women detained there has rarely exceeded over 50. So this again just raises questions about why it opened in the first place. So Derwentsside is also an extremely remote location, which makes it very difficult for family and friends to visit the women's detention, and means their mobile phone reception is also very poor. Can we go on to the next slide, please? So, as I mentioned, there are a lot of harms for detention for women specifically. So being detained exacerbates the trauma these women have already experienced as they're subjected to these harmful conditions. So this includes being watched in intimate situations by male detention centre staff. Detention is also distressing in itself, and women are re-traumatized, as I keep mentioning, through the very fact of being locked up, and a trauma that is heightened by the lack of statutory time limit on detention, because people don't know how long they're there for. In the UK, we don't have a time limit, so people can be there for years or days, or no one never knows. So that is another stress that causes this these mental health issues within people in detention. So women have no idea when they'll be released. So many women in detention have reported being subjected to sexual humiliation by the staff as well. And the denial of access to social networks and finances also makes it impossible for them to get a lot of the help that they need. And from September 2024, you can see the stats that are on the screen. So almost half of the women in immigration detention reported suicidal feelings, which is way too many. 91% reported poor mental health. 71% of surveyed respondents by Women for Refugee Women in their report in 2024 said that they felt that they were watched by male staff. And 85% of women said that being in detention made them feel anxious or depressed. So again, just causing a lot of issues for the mental health of these women. And then obviously it affects the physical health as well. And the populist baiting nature in which the consecutive Home Office administrators have handled asylum has given rise to a lot of misogyny being weaponized in the UK's immigration systems as well. And through the current government has promised to halve violence against women during their time in Home Office. They've really failed to suggest how this will relate to women in immigration detention or refugee women as a whole. So again, they've left out a whole population of women in the UK that really do need this violence halved as well. Can we go on to the next slide, please? So these are two experiences of women in detention. The first one is from Agnes. You can see her on the screen campaigning as well. She's a spokesperson for Women for Refugee Women, and she's been in immigration detention as well. So she says, when you come back here to seek protection from abuse, exploitation and persecution, but instead the Home Office locks you up. You wonder if you are in a good country or in hell. I'm still living with the trauma of detention, and I don't want other women to go through this pain. Agnes actually spoke at one of our events for International Women's Day this year. So if you do want to hear her speak her own story, then I'll pop a link to that as well later. And then we have Vogue as well on the screen. So after I have been detained for several months, I couldn't see the point of my life anymore, and I tried to kill myself. So you can really see the desperation that these women really feel in detention. Can we go on to the next slide, please? So now I'm just going to quickly talk about how immigration detention centres are inspected, and what the inspectors have seen, basically. So the way that they're inspected is a lot of the inspectors goes in blindly, so they don't tell the immigration centre that they're inspecting, just so that they don't, make it look adequate, basically. But since campaigning to end immigration detention at René Cassin, I've attended a lot of wide sector meetings with the chief independent inspector of prisons. He's the one that inspects the detention centres. And as I sit on the Detention Forum's board as well, we hear a lot of these experiences. So each time the inspector inspects the detention centre, his team carries out a thorough investigation of the premise, speaks to the detained refugees and the staff, and is basically inspected head to toe. And I'm going to give you a case study of Harmondsworth, again, like I mentioned earlier. So when they inspected Harmondsworth, I think it was last year in the last report, the largest immigration removal centre adjacent to Heathrow, and interviewing detainees, they found it to be in an absolutely awful state. He described the detention centre as strongly smelling of sweat and smoke, whilst having a really heavy sense of depression. Windows, toilets and showers were broken. So again, it didn't really give privacy to people in detention. And it undermined their human dignity. And he specifically said that when I heard him speak as well. So people were forced to share rooms, and isolation was used as a form of punishment rather than a private area where people could go. And I think the most shocking thing that I found was that police officers were seen to be smoking drugs on the site at the detention centre, and without staff challenge. And 1 in 10 people said that they developed a drug problem since coming into Harmondsworth, having never tried drugs before as well. So they also found that the staff lacked adequate training, and people were held in detention centres for far longer than they needed to. 1 or 2 instances for longer than 2 years. So there was no mental health support, and no actions were taken to help individuals. And this was 1 year ago, as I said, so showing gross misconducts of the treatment of refugees and asylum seekers held in detention. Can we go on to the next slide, please? As have I spoken a lot of heavy, depressing topics on this? What are the alternatives that we as organizations campaigning on this are proposing? And the main thing is alternatives to detention. So if people are afforded their liberty, they will have more access to support from their family, friends, and communities. And alternatives to detention provide thoughtful, comprehensive support to people to address their needs, reducing stress and trauma. And it is the most cost effective, which this government seems to prioritize over human dignity, which we need to keep pushing. So what is the sector proposing? Can we go on to the next slide, please? The first thing is community placement and support. So individuals can live in a community and receive regular check-ins from the authorities, and community support programs engage local communities such as faith communities, non-profit organizations, and volunteers to provide housing, transportation, and other forms of support for those awaiting immigration proceedings. The second is employment programs, so providing opportunities for employment and education that can help integrate asylum seekers and migrants into society. And this can reduce the likelihood of future immigration violations and, importantly, reducing the risk of mental health issues. And providing support services such as legal assistance, housing assistance, and access to healthcare can help individuals comply with immigration requirements and not resulting to detention. And finally, assigning case management, basically. So assigning refugees and asylum seekers to case managers who help them navigate the process. So this helps both the asylum seekers and authorities and takes away the need for a blanket policy that treat all asylum seekers, as we often hear in media, as criminals. So that's the best case scenario of this. So there have been many successful pilot projects for alternative detention in the UK, and a substantial reduction in costs compared to detention, and a high success rate of clients regularizing their immigration statuses. And the one I'm going to take you through is the King's Arms project. So in 2023, the King's Arms project.
4 or 5 minutes, I'm afraid.
Perfect. I'm wrapping up. It ran a pilot called the Refugee and Migrant Advice Service, which provided caseworkers and legal aid to asylum seekers. And this scheme was found to be 2/3 cheaper than a detention centre, and resulted in 80% of clients being offered visible and viable options to regularise their immigration status. Can we move on to the next slide, please? So 80%, it had an 80% success rate, as I said, and it was 70% cheaper. So those are the most important statistics to kind of take into account. And all in all, there remains hope in the way that immigration detention is run in the UK because of these different policies and regulations and successful pilots and proposals that the sector is proposing. So organizations such as René Cassin and all our partners that work tirelessly on this are working to ensure that mental health and dignity of refugees is upheld in the asylum process, so that it is a more compassionate and a more fair system. And that's me. Can you go on to the next slide, please, Christina? There's my email if anyone wants to get in contact about any more information, on our website as well for any briefings. Yes, thank you.
Thank you so much. That was really fascinating. I'm just looking at the time. So what I'm going to suggest people do is, if they have any burning questions for you, if they could put them in the chat, and then we go into Anna, and then we'll pick up the questions as we go through at the end. So it gives us, say, 10, 15 minutes after. I don't know if everyone's got to rush off immediately at past, but otherwise, if we're okay running 5 minutes later, if our speakers are able to do so, otherwise we can feed questions back subsequently. So I'm going to invite people, as I said, please put your questions in the chat. Thank you so much. That was really fascinating, heartbreaking, but fascinating. And now over to Anna.
Thank you. I will just get my slides up. Okay. Does that look like it's worked? I now can't see any of you, but can you see what looks like slides? A picture of a
Yes.
van. Yes.
Yes, we can.
Okay, brilliant. Okay, thank you. So I'm Anna Miller. I'm the head of policy and advocacy at Doctors of the World. And I was going to speak to you today. I'll do a little bit of an introduction to Doctors of the World's work more broadly, but I was going to speak to you particularly about a particular programme that we have run in Wethersfield, which is unlike the circumstances that Łucja has just been talking about, where people are held under detention powers. Wethersfield, which is an asylum accommodation site, strictly speaking, people is not a detention centre. People are not held under detention powers. They are free to come and go, but there are many features of it which I will show that are very similar to the situation and circumstances of detention, and it's a setting that is sometimes described as quasi detention. So just a little bit of background about Doctors of the World. We are the UK chapter of the Médecins du Monde International network. We work in the UK, and we provide primary care clinics both in London and then remote services to people who are based outside of London. We'll see anybody who's struggling to access mainstream NHS care. Our clinics are largely staffed by volunteer GPs, practice nurses and support workers, and a big part of our work is carrying out advocacy. So advocacy on behalf of individuals to get them integrated into the NHS, but also using the evidence and data that we collect through our medical programs to try and address the more systemic reasons why people aren't able to access the NHS. Our patients are very varied, but the thing that they have in common most is a history of migration and some type of insecure immigration status, or in some situations no immigration status at all. But I guess for today's presentation, the people I'm going to talk about, the programme that we were running, it was everybody accessing it was people who were resident at Wethersfield. So they're all people who had applied for asylum in the UK. So I guess for this cohort of people, they had sort of exactly the same immigration status. So the service that we ran was at the former RAF military site in Wethersfield in Essex. So it's a Royal Air Force site that hasn't been used for a couple of decades, and it was opened up as part of the Home Office's broader policy of trying to shift away from accommodating people in hotels and accommodating them in alternative sites, and this was one of the sites. It was opened in July 2023. Wethersfield is a very isolated location. It is a couple of miles, it sits between a couple of miles each side between two villages, but extremely small villages. We're talking sort of village shop and a pub size villages, and it's 8 miles from the closest town, which is Braintree. It's accommodation only for men, so only men are accommodated there, aged between 18 and 65, and it has a maximum capacity of 800. That's actually reduced from us. The Home Office had a higher aspirational number initially. The Home Office it recognises that this type of site has the potential to be harmful and isn't suitable for everybody, and so they have a suitability criteria policy, and the policy says in it that former military sites are not suitable for survivors of torture, trafficking, and those with the most serious physical and mental health needs. And as we're going to come up against, you'll see that even the Home Office's recognition of this butts up against the reality of who people in the asylum system are. You know, when you're looking at if you accept that the people with these types of histories aren't suitable for the site, when you look at asylum seekers, people claiming applying for refugee status in the UK, you're going to find very few people who don't fall within this definition. I don't think this is official policy, but based on our experience of being there and other organisations, everybody at the site has crossed the channel from France or Belgium, and they had crossed very, very recently. Most of the people who we saw had arrived in the UK and then been moved to Wethersfield within a matter of days of arriving in the UK. So it sort of really is very much sort of like new arrivals from channel crossings. And this situation has changed a little bit now, but at the time that we were operating in Wethersfield, when we first went into Wethersfield, and for the first 10 months, the UK government had just passed the was going through the process and then passed the Illegal Migration Act, which barred people who arrived in the UK without permission from claiming asylum. So everybody we saw there, they'd made an application for asylum protection, but they were all at risk of being issued notices that their application was inadmissible, and that therefore meant that they were at risk of another policy that was being run at the time, which was the Rwanda policy. So really this very much was the cohort of people who were at high risk of the government trying to remove them to Rwanda. And that was a very, very present fear and concern at the site. So I'll tell you just a little bit about the clinic that we ran. So it was a mobile clinic that we ran. We ran it outside of the gates at the site. I think you could see that my initial slide showed the van just parked outside of the site. The site is, as it's a former military site, it's got a very sort of militaristic feel. It's surrounded by barbed wire. There is a security guards on their gate. You can't just, so the residents can leave and come and go, but we and members of the public, visitors, can't go in. So we took our mobile clinic 3 days a week and parked it just outside the gates of the site, and people who were in the site were able to come out and access our services. The project was run, it was a collaboration between Doctors of the World, sorry, I can see there's a typo here. There's a collaboration between Doctors of the World UK and MSF UK OCB, so Belgium and UK MSF. We ran the clinic between December 23 and December 24. And we offered in-depth GP appointments, which were always using an interpreter so that the person could speak in their primary spoken language or their language of choice. And the approach that we took to GP to the appointments is the same that we do in all of our clinics. They're very in-depth, holistic assessments that explore a range of issues. It's not like your standard 10-minute GP appointment. On average, our appointments take an hour and 10 minutes. So they're very holistic assessments of a person's situation. These assessments then enabled us to do limited prescribing, but also to make safeguarding referrals to emergency and mental health services. And also a key part of the service ended up being providing medical evidence to individuals, which they were then able to use to challenge decisions to place them at the site. I spoke earlier about the suitability assessment that said that certain people weren't meant to be there. What we were finding, as I will come on to in a minute, is that there were a large number of people at the site who fell foul of the policy, but they needed to have medical evidence to challenge the Home Office decision to be able decision to accommodate them there. So we were able to provide them with that medical evidence off the back of the appointments we'd provided. So I'll just quickly go through what we saw. I've put at the bottom of my slides, I'm happy to share my slides, a link to the report that we've published based on the data, which you can see on one side of the screen. But just to give you a little bit of an oversight, on average, the people who we saw were fairly young. The average age was 20 to 29. The most common countries of origin were Iran, Eritrea, Afghanistan, and Syria. They're all refugee producing countries, and they're all countries with very high grant rates. So based on that information, good reason to believe that the majority of the people there, if they were allowed to, if their asylum claims are actually processed, that the majority of them will be found to be refugees. 3/4 of people disclosed a history of violence in our consultations. The most common type of violence was experience of living in a country with armed conflict or war. That was followed by experience of being tortured, and then experience of abuse and violence by police or armed forces. And I think that statistic is, and the number of people with that type of experiences is particularly relevant when we're talking about the site that people were living in here, which was a very sort of like militaristic feeling site, and a very re-traumatizing environment for people who'd already had that type of experience. 62% of people presented with severe psychological distress, and 30% of people presented with suicidal ideation or planning, which is an extraordinarily high percentage, and higher than we at Doctors of the World have ever seen in any of our programs, and similar to the levels of distress that MSF have seen in one location before, which is Nauru, the island off the coast of Australia that is used as a offshoring site for asylum seekers. 39% of people had symptoms consistent with PTSD, and we analysed our data based against the Home Office's suitability criteria to make a sort of like rough estimation of the percentage of people we were seeing who weren't suitable for the site, who had a history that meant they shouldn't have been placed at the site, and estimated that brought up about 75% of the people we were seeing. This is not our data, but government data now shows that between July 23 and December 24, just over 250 people were moved from the site once they made an application with evidence that they weren't suitable to be there. So a huge number of people who shouldn't have been at this site, according to the government's own policy. I'm just going to see if I can get this to work. This is a sort of tech test. This is an audio file.
Can't hear it. I don't know.
You can't hear it, right?
Christina.
Okay. No, don't worry. I thought that was...
Anna, when you share your slides, there's a little button when you press the share button to say share audio. That might be all you need to do to get it to work. Right.
Okay. Give me 1 second. I'll give it one go. And if not, we'll, this is what I need to go back into this, don't I? Yeah. So maybe if I just stop sharing and then try. Right. So share.
And right at the top,
screen.
It should say include sound.
Yes. Okay. Brilliant. That's something new I've learned. Okay. Yeah. So I'll have a go at playing this again. Then it is an audio testimony from one of the men that we met at the site.
We arrived at Dover in the beginning. They asked us some questions. We were so tired, you know. Basically couldn't open my eyes. I didn't know where I am. In Wethersfield, they mentally torture you, not physically. It's like they play a game with our mental health. When you come out, it is a 30-minute walk to get to the nearest town here. We cannot get up and change places. We cannot do anything. Just be here. We can't live in an isolated place like Wethersfield. We deserve a little bit human right, you know? Not much, just a little bit. A little bit of courtesy. They treat us like basically not human beings from the day I arrive. I don't feel like I'm in the UK. We want to be with the people in the community. I see on social media now, outside, people giving riot. I'm scared for my own life now in this country. I'm 24 years old. I look old because I have too much stress. I have not eaten for 15 days. Sometimes I get stressed and I don't eat. Sometimes I eat, I overeat. All of us here are frustrated. The weirdest thing is a lot of people go on suicide. That is affecting me more than anything. 10 people till now, they tried to kill themselves when I was on the camp. I don't believe the GP at Wethersfield is a professional mental health. He's just a doctor. He give you some pills for a week. They don't work. He give you something stronger. I feel like in an empty, dark place always because I don't know what is going to happen. I'm barely sleeping now because when the interview comes, because I lost my chance to have a normal life. I don't ask for a lot. I just want to live in a small box and call it my home, somewhere safe. We arrive at
Sorry.
Dover.
Sorry, I don't mean to play that again. I'm trying to move to the next
In the
slide now.
beginning, they ask us some questions.
Right. That bit, that's what I need. Right. Okay. So based on the data and evidence we collected at Wethersfield, we concluded that the containment site setting itself was causing harm to the health, particularly the mental health of people at Wethersfield, and made a series of recommendations, which included that the site was closed as a matter of urgency, and to end the policy of using mass containment, and to reiterate a policy position we've had for a long time, which is that people in the asylum system need to be placed in dignified and safe accommodation, but crucially that needs to be within the community as well. One of our biggest observations at Wethersfield was the absence of community and connection as a sort of like protective factor, particularly for people struggling with their mental health, that was the sort of like the crux of the problem with Wethersfield. It's entirely isolating situation. My final two, sorry, I'm struggling. That's what I need to do. Okay, so I think this is my final slide or penultimate slide, was just to talk a little bit about what can be done or what individuals can do, thinking particularly from the perspective of clinicians and I guess people working within the healthcare system. There is a huge amount of potential for clinicians to play a supporting role for asylum seekers and refugees, but people in the situation in Wethersfield, but also people in the asylum system in other types of accommodation. I've highlighted a lot today the challenges about Wethersfield, but the hotel alternative is also not great at all. We provide services in hotels to people who've been in hotels for extended periods of time, and that also brings multitude of problems and can be a very terrible living situation as well, particularly for families with children. So the first thing I wanted to highlight was a resource that we're about to publish, which is called our Safe Surgeries Toolkit, and it's specifically to support clinicians. It's largely targeted at primary care clinicians, but I think a lot of the information is universal, it's sort of applicable to clinicians working in other types of settings, but it's really designed to support clinicians who come in contact with people who are in any stage of the asylum system. So it might be hotels, but it might be the large site in Wethersfield, which is still open, or it might be people who are not in home office accommodation, but still going through the asylum system. It's full of very practical information, and also in it sort of attempts to try and demystify and explain the asylum system a bit, but it also goes into quite a bit of detail about the practical ways in which clinicians and medical evidence can support people in like realistic ways in which clinicians can make evidence and information available to their patients. We haven't launched this resource yet, so I've put the link here for our website which is where it will be hosted, but also it gives the opportunity to sign up to our Safe Surgeries Network, which is a network for clinicians who are committed to providing holistic medical care for new refugees, asylum seekers and migrants in the UK. So that's my best suggestion at the moment. If you sign up to that, once we launch the toolkit, you will be notified about it. So I guess that was my practical suggestion on what you can do on a day-to-day basis. And then my other suggestion was thinking about the importance that a strong medical voice opposing harmful border policies can play. a number of the Royal Medical Colleges and the BMA have taken increasingly strong positions opposing various immigration policies based on the harm they present to patients, but also the strain, stress and pressure they place on the clinicians who are looking after patients in this situation. And the Royal Medical Colleges and the BMA, they're all also organisations with an element of democracy within them, and a lot of the changing positions within them has been through activity of members, motions posed by members. And I've put an example at the bottom of this slide of a motion that was passed by the Royal College of Nursing last year, which we thought was a pretty good position for a Royal Medical College to take. So that just has now shown you the an example within the Safe Surgeries toolkit of the sort of like practical checklists and advice that the toolkit gives. And then, yes, this is my final slide, which has got my contact details. We will also be publishing the data we collected at Wethersfield. We're writing up into an academic paper with St George's University, along with some sort of qualitative analysis of testimonies. So that will also be coming soon.
Thank you very much. Well, I'm just thank you both. Wonderful, wonderful speakers. I'm actually going to ask you each before, because surprisingly, there's no questions in the chat, which we normally have, but people might want to put their hand up and ask some questions and ask 12, 13 minutes. But do you have any questions for Anna and vice versa? Now you've heard each other speak, I'm just wondering, what synergies you see, if there's anything you have a burning desire to ask each other, because we've got the legal and we've got the health, and we've got about women in detention and men in quasi-detention. Sorry, I'm putting you both on the spot there. If not, I have some questions. Well, sorry, go for it.
Well, I mean, one of my sort of main observations is I think one of the things that probably crosses over so much between the situation that Łucja was talking about and the situation that I was talking about is the sort of like the impact of isolation and being detached from community on ultimately mental health, and how essentially effectively what it ends up doing is stripping away what I guess you would call the protective factors. When somebody's struggling with their mental health, you would look at protective factors, like what are the things that are going to help them in this situation, make them a lower risk. And what we very much found in Wethersfield is you've essentially got nothing: community, separation from family, hope for the future. None of those things are there, and that sort of was the real crux of the problem. And so I guess Łucja, that's probably extremely similar to the situation and circumstances you see.
Yeah,
Detention.
definitely. I think it's the othering and the distrust that staff or people have with people in detention as well. As I just remember one instance where a woman was having a heart attack and she was going to be deported the next day, and the staff didn't believe that she was actually having a heart attack because they thought she was faking it so that she wouldn't be deported the next day. She luckily survived. I've spoken to her before, so she was fine. However, there's a massive distrust because people don't believe that you're actually suffering, or that you have a mental health condition, or that you are physically unwell because of this fear of being deported, for example.
Yeah, I would definitely echo that at Wethersfield. As whenever anybody tried to raise issues that why they shouldn't be there, and like the feedback that we got from the staff and the clinicians, because there was a medical team on site, was that everybody just says this to get out of here. It's not true. Like the culture of disbelief was really pervasive amongst all the staff, including, I'm really disappointed to say, amongst the clinical staff there, that there was it's not mental health issues, it's just everybody trying to get out of the site.
I'm going to open open questions up to the floor, and see if there's anyone who's got anything in particular you want to ask. And other than that, I've got a couple of questions. I'm surprised we haven't got a lot of people leaping up and down already, we can see hands if anyone's got any questions they'd like to ask from the audience. Oh, yes, Sarah's put in here, what leads to Home Office decision to detain an asylum seeker in detention centre as opposed to providing other types of accommodation? I don't know who wants to go first on that.
I can jump in. A lot of the time, if they've come illegally, that's one of the ways. Another way is for deterrence, because they don't want more people to come over. And those are mostly the two biggest reasons. Sometimes it's just random because their asylum processes haven't been claimed yet, so they just randomly get put in a detention centre because they don't know what to do with them. That happens quite a lot, and that's why a lot of people come and go as well, because they're awaiting or they're unawaiting their claims. So yeah, those are kind of the three big three. I don't know if I missed anything out, Anna.
No, we don't work in detention actually, and so I don't really know that much around the policy around it, but my bit of experience is entirely arbitrary, like quite punitive.
Yeah, and I think with the current well, there's a NABA bill, the Nationality and Borders Act, but also the current bill that's Security and Borders Act that they're going through right now. It doesn't limit any of this, which is although they've obviously, Labour's got rid of the Rwanda scheme, thankfully, that we're all very happy about. They haven't limited the possibility of people being arbitrarily detained as well and deported. No time limit on detention obviously is the biggest issue with this, and then the alternatives that we're proposing. But yeah, as we said, it's just random and inhumane. And performative, as I mentioned, a lot of people just, I mean, the government wants to show us as if they're doing something about the immigration system in the UK, and therefore they detain to say, well, we've detained this amount of people, we've deported this amount of people. But actually, it doesn't deter people coming. Right now, the same amount of people are coming over to the UK as they were, even though Labour's put up all these different claims and restrictions on immigration, but they restrict things like students not being able to come, restricting the amount of people that can come and work in the UK. So obviously immigration goes down, but the actual boats coming remain the same. So it's very performative a lot of the time.
Thank you. I've got several questions here, so if anyone else wants to leap in, if I'm dominated too much, I'm going to start off with one question. Thank you very much for that answer, both of you. There were a couple of things that struck me, and I think coming back to the issue of women, I have done work with women asylum seekers and women refugees in the past, and particularly their experiences with GPs. It's an old piece of work, but if anyone's interested, get in touch and I can sort of put the link in the chat. But I mean, this thing about disbelief. So I was very struck with this figure of male guards, basically, in institutions where women are in detention. And I believe you actually mentioned as well sort of sexual assaults and things. So I was just wondering, do we know sort of more about the impact on being guarded by men? Particularly women might come from cultures which are more gender segregated as well, quite apart from sort of prior experiences. Now, you talked about people feeling they were watched, but I'm just wondering if there's been successful cases challenging, you know, in some ways because of the impact of being guarded by men. And the other question I want to ask, and this is both for men and women, so quasi-detention and detention. And as I think some of you know, we're also working in Wethersfield on one of our projects, or with people in Wethersfield on one of our projects. But given the recent Supreme Court judgment, I'm thinking about people who are trans-identified. So in the sense of what is happening, do we know what's going to happen for people in that situation? Or is there any evidence from the research that you both are aware of trans people who've been in detention, or for example, in Wethersfield? Big question, sorry.
I can start. In terms of women being watched, I'm not sure there've been any successful cases. I will put a link to Women for Refugee Women's report on that you can read more about this, but I don't think there has been any successful cases. I think it's remaining the same, to be honest. And I think a lot of the time it's a power thing. To reduce and control the situation, and unfortunately, I don't think it's changed in any way. And sorry, I forgot the second question.
People who are trans as well. So we've got the New Supreme Court case, but also people's prior experiences in the sites you both mentioned.
So I haven't heard of any cases, but again, I'll send, it'll probably be best to check with Rainbow Migration, because they've done a lot of work specifically on that. Yeah.
Anna, did you want to add anything?
I don't actually really have anything to add. We didn't come across anybody at Wethersfield who was trans, and I haven't also heard it from other organisations, but it's a very interesting question, because but in terms of like what the government's policy, there's one thing what they're actually doing, but also what their policy is around it. Presumably now, following the Supreme Court judgment, trans men could be sent to Wethersfield.
Indeed. Well, I think it's one of those watch that space, really, and be involved in campaigning. We've got just 3 minutes left, so I'm going to invite our speakers both to say I want to say thank you again so much. My other question again was thinking about food quality, because again in Wethersfield, where we're working, we're finding interesting men are saying the food has improved and there's plenty of it, so they quite like it, which is a real interest to us, because we know normally food quality in both asylum detention or quasi detention is normally very bad. So I don't know if anyone's got anything I want to add in the last minute or two about the food quality that you're aware of and how this is impacting, because obviously nutritional issues are going to impact on people's well-being, physical and mental health as well. That's something that's come to light. Sorry again if I'm putting you both on the spot there.
Yeah, no, I can say a little bit about it. I'm glad to hear that you're beginning to collect evidence that people are happy with the food. We got lots of people complaining about the food. It was after the isolated nature of the site, feeling unsafe within the site. It was the third most common sort of complaint issue that people raised with us, and sometimes that it also translated into medical issues as well. But one thing I definitely say about Wethersfield is that it's not good enough at all, and there's sort of some inherent features of the site that will mean it's never suitable accommodation for people with the types of histories that asylum seekers have. But the point at which it was set up, the sort of the way it was run, the sort of like processes, safeguarding, or I'll be honest, absolute lack of safeguarding processes in place, it was all extremely poor, and a huge amount of improvement has been made. So you're getting sort of like, and this was a point that the independent chief inspector of borders and immigration said. He was like, you're getting somewhere close to now this running like almost acceptable prison, but for a long time it was running the type of standard, the sort of like the safety risks, safeguarding issues, those types of things were not even the standard that you would be acceptable in prisons. That was like his initial advice on the site, and it's taken about 18 months to get to the point where the site is sort of like somewhere operating in a acceptable way, but I would caveat that with it's still not suitable for this population. But so yeah, I guess maybe sort of food as well is something that has improved over time.
Yeah, well, that's obviously because we had been collecting data for a little while, but it was something that we really didn't expect, that the men are telling us the food is improving. They can have additional portions. And some people who had really horrendous journeys said actually for the first time they're beginning to feel full. And I know that wasn't what was found before. But I think generally, isn't there, in accommodation, whether in hostels, hotels, or sort of detention, normally food is really poor from my experience. We're 6:31, we're a minute over. I really want to thank you both. Just amazing presentations, really powerful. Again, I hope if anyone does subsequently come back and go, I really want to ask this, if you could leave us some questions, or if they want to write to us, we could hopefully forward on. And again, I really hope that everyone's going to consider joining in the campaigns, because your organisations are doing such really amazing work, and we will be sharing this recording, of course. So please join us for future sessions as well in our webinar series. Christina, I don't know if there's anything you want to say about that. And other than that, I'm just going to thank our amazing speakers. Christina, anything you want to add before we wrap up quickly?
Thank you for joining, everyone. This was our final webinar for this kind of academic year. So we'll be in touch with our next seminar, which will be around kind of September time. But thank you, everyone, for joining. We'll be in touch.
Thank you. And a round of applause, please, for our speakers. Unless there's anything else anyone wants to say. It's been great. Thank you.
Thank you very much.
Thank you.
Thank you so much.
Thank you. That was brilliant.
Glad you found it enjoyable, I hope. Good.
Thank
Sorry,
you.
still a few people there. Thank you. It's been great. We'll be in touch and we'll email as well properly, and thank you afterwards. Have a good evening. Really appreciate it.
Thank
and I'm
you.
sure I will see you both, around and at various events and things going forward. All right, see you later.
Yes.
Bye for now.
Bye-bye.
Bye.
Thank you.
Thanks.
Bye.
Bye.